I'm Crystal, and this is Lindsay. And this is a new series that we're starting to discuss some of the issues at Project Chimps. We're not going to go into the whole backstory. If you want to know that, I would suggest checking out helpthechimps.org. Lindsay and I are both former employees of Project Chimps. Everything is documented on the website. So with this series, we're just going to focus mostly on discussing the most pressing issues. And each episode will kind of go over various things like the medical issues, the lack of outdoor access, the lack of enrichment, the lack of a training program. But right now, the most pressing issue, since Discovery Days is next weekend, is the lack of COVID precautions. And Discovery Days is an open house where Project Chimps welcomes the public on site. And the thing that concerns us the most is that masks are optional. So the public is going to be coming on site. It's usually hundreds and hundreds of guests. They're not screened in any way, and they are not going to be required to wear masks. These are large tour groups who will be coming into contact with the staff. They will not be in contact with the chimps, but they will be in contact with the staff because the staff will be stationed at the windows around the habitat, and then the staff will be going back into the chimp buildings.
So as Crystal stated, there's a major issue with the Discovery Days event coming up as well as Chimpcation. And so one of the things that we really wanted to do was find out what other sanctuaries were doing to protect their residents from COVID-19. So what we did was we sent essentially a survey out to 12 primate sanctuaries to kind of gauge their responses and their protocols to the COVID-19 pandemic. So from the spreadsheet, you can see how many sanctuaries are taking the issue seriously and the different protocols that they've put in place. For example, we're talking about, are they screening temperatures and for their staff? Are they requiring masks for everyone? Have they canceled or rescheduled public events? Are they still holding volunteers on staff? So as you can see here, we took a variety of information and just categorized it based on the different sanctuaries. So some of the major things that I think we need to note here is that the volunteer program at several sanctuaries has actually been suspended. Center for Great Apes, Chimp Haven, Fauna Foundation, Primate Rescue Center, and Cleveland Amory Black Beauty Ranch have all suspended their volunteer program. And I think that's really important because you're limiting the amount of excess people, non-essential staff members that need to come on site. So that just reduces the chance of exposure to others. Also, active monitoring for the residents for symptoms of COVID-19, I think, is so important to make sure that no one has already been exposed. And so that includes like taking temperatures, just keeping track of any symptoms that you may see. And so Center for Great Apes, Chimp Haven, Chimp Sanctuary Northwest, Fauna Foundation, Primate Rescue Center, and Black Beauty Ranch, almost all of them are doing this. The only ones that are not are Project Chimps and Primate Inc. But obviously, what we want to talk about today, the main issue are these large public events. So out of every single chimpanzee sanctuary or primate sanctuary that we surveyed, the only one who is still holding these large public events is Project Chimps, and that is a major concern. So Crystal, do you want to talk a little bit about why that might be so concerning?
Yes, so chimpanzees are very similar to humans. That's why they were used as human models in medical research, just like the chimps at Project Chimps. And they're especially susceptible to respiratory diseases that they can catch from humans. So during flu season, the staff are required to get flu shots. Unfortunately, the chimps don't get flu shots, even though many chimps at zoos do get annual flu shots. But they're susceptible to the flu virus, they're susceptible to pneumonia, and the common cold. If a staff member is sick, the chimps are very likely to pick that up if the staff member doesn't stay home. So with COVID and there being so many unknowns and no vaccine, the chimps are very likely to pick that up if a staff member comes to work sick. And if they're coming into contact with so many members of the public during these open house events and then going back to work with their chimps, they could be non-symptomatic, or it could be a week or so before they develop symptoms and they're having all this contact with the chimps and their food and their enrichment before they even know that they're sick.
So we're mainly concerned that Project Chimps has these two large events coming up. They have Chimpcation, which starts on September 21st and runs for a few days. And they also have Discovery Days, which is held on September 25th this year. These are huge events. They get a lot of people in. I mean, Crystal, can you remember how many people you think came to the last Discovery Days?
I cannot remember. I think each Discovery Days breaks the record of the previous Discovery Days.
Right.
It's always like a sold out event
Right.
with tours back to back all day long. And you can pay for different levels of tours. So it's not just, you pay for your tour and you drive around the habitat and you look through the windows. You can also do VIP tours where you get a private tour, and that's not really advertised as much, but they cater a lot to the donors. So you don't really know what sort of access they're being given.
Absolutely. I think one of the reasons that we are focusing so much on COVID-19 is because we know that the veterinary program that's in place at Project Chimps is not what it should be. They're not providing the absolute best care. And so with the potential that COVID-19 could bring a really severe respiratory illness to the sanctuary, I think that's why we're so worried about these large events that could just bring in, how many people potentially, and could expose one chimp, and you get one chimp sick, and then that's multiple chimps sick. And that's why we're so, I think, concerned about this, is because it only takes one to get really sick.
Yes, and I think Project Chimps is hoping that this will die down people's interest, and that's what we don't want to happen, because there are 78 chimps there, 78 individuals who are not receiving proper care, and we're going to highlight that in upcoming videos. We're going to interview professionals in the field, so that it's not just coming from us, and we're going to go over solutions, potential solutions, because we want Project Chimps to succeed. We believe in the sanctuary, and we love the chimps.
A recent article by Damas et al. Came out and stated that chimpanzees are at very high risk of contracting the coronavirus. And so I wanted to get a little bit more of an expert opinion on that article. And so we reached out to Dr. Jess Hartel from the Kibale Chimpanzee Project and University of North Georgia to give us a look and more of an explanation of what we can really gain from this article, especially related to chimps and other primates in sanctuaries. Jess, thank you so much for meeting with me and, being willing for me to talk to you today. The first question that I have is, if you could just introduce yourself and, tell us a little bit about your background.
Sure. My name is Jessica Hartel, and I am a lecturer at the University of North Georgia. I'm also the Director of Conservation for the Kibale Chimpanzee Project, which is a long-term field site that is in Uganda. And it's been in operation since 1987. So we've had over 30 years of presence in that area. And so I work with wild chimpanzees. I study their behavior and also elements of their conservation, as well as manage our active conservation presence in the area. But I also have experience working with captive chimpanzees as well. And so in my background, I've worked with captive chimpanzees in various sanctuary settings, and I've also worked with chimpanzees even in biomedical laboratory settings as well. So I kind of have a broad overview of chimps in both wild and captivity. So it gives me a kind of a unique perspective when I'm studying chimps and thinking about their well-being.
Absolutely. I feel like it probably gives you a good sense of insight into the differences between a sanctuary chimp and a wild chimp as well, because they are so different.
Absolutely.
Can you talk a little bit about how has your field site in Uganda been impacted by the COVID-19 pandemic?
Yeah, so Uganda actually initially did a really great job of controlling the COVID-19. Initially, they basically went into lockdown really quickly before they even had any cases that they knew about in country. And so they essentially locked down the airports. They were very careful about who was let in. People that were coming in from countries that had coronavirus were being quarantined, and they were monitoring that really closely. But inevitably, the virus made its way to Uganda. And so as a country, they've been dealing with that, and it's still kind of ramping up there. So what we did as a field site in response to that, initially when we kind of started to realize what we were dealing with here globally as a pandemic, we started discussing what that meant for the chimps in Kibale National Park. And so we normally have a international researchers that are at the field site. We have students that are there, both international and national students. And then we have our long-term staff, which includes field assistants and also snare removal teams that work in our conservation sector. And so we had to think really carefully about how we could really protect the chimps, because we have to assume whatever diseases that we can get as humans, because chimps are so closely related to us, they can also contract and get. And we also have to assume that the symptoms would be very similar and the potential risk would be very similar, especially in a novel virus that we knew nothing about at the time when we were making these decisions. And so immediately what we did was basically shut down the field site. So all of the international researchers left. They had to go back to their countries of origin. This was also because we knew the Ugandan government was going to be locking down the airports. And if they didn't get out, they could get trapped there for an undetermined amount of time. And we didn't want to overwhelm the Ugandan healthcare system with people that were there and couldn't even really be doing the research anyway. And Uganda was going to be strapped for their own, providing for their own people. And so we did that. We got those researchers out. And then we're also working with the local wildlife authority and what they're recommending this entire time. And then we actually ask our employees to, if anyone was willing to volunteer to quarantine at camp away from their families, just so we could still provide some health monitoring of the chimps, but not introduce, hopefully, any risk if people are quarantined at camp. Full donning in PPE whenever you went into the forest. So masks, gloves, no eating in the forest, no using the restroom in the forest. You know, these are all things when you're working at normally a 12 to 16-hour day, sometimes our field assistants do. You have to engage in those behaviors. So we said none of that. And then we reduced the amount of time they were in the forest. Normally we have a 5-meter distance that we expect field assistants to keep from the chimps. It went to 10 meters. So a lot of times they were doing these observations, even using binoculars, because they weren't allowed to get close enough to really see, being really quiet, listening for any, you know, health concerns that way. So conservation team continue to operate at full capacity. And this is because they don't regularly encounter the chimps. They will sometimes hear the chimps. They're not tracking the chimps. They have a different goal. They're looking for snares, which is a predominant threat in Uganda. And so we felt like this was still a really important thing, because when the Uganda Wildlife Authority, they did make the decision shortly after we started putting these parameters in place that they were going to shut down all primate research and tourism sites. So they made the whether we were going to make that decision or not, they ended up making it for everyone else as well. So in doing that, that was announced nationally. So now poachers know that there's a reduced presence in the forest, right? There's less people working, there's less people visiting, so less chance of being caught. And so we knew that this could essentially end up being a spike in illegal activities. So we actually, the Uganda Wildlife Authority actually requested that we maintain full capacity with our conservation team, because they also needed the help. And actually what we saw in April, the first month where everything was fully shut down for the whole month, we saw a 700% increase in illegal activities in the home of our chimpanzee population. So it just skyrocketed. Now, interestingly, in the following months after that, the illegal activities returned to normal baseline levels. So I think the poachers realized, oh, wait, there still is quite a lot of people in the forest. Not everything stopped. So that's my best guess as to what happened, is they realized, okay, teams are still operating. So there's still a high chance of getting caught. But anyway, so yeah, so we're still constantly evaluating that and figuring out what our next steps are.
Right. Well, I'm glad it sounds like you Kibale has been taking a lot of, precautionary measures, trying to keep everybody safe, their human staff as well as the chimps that they follow. So that's really good. And everything has been okay so far, which is great. I know with this, everything's constantly changing. So I can't imagine how, how many balls are in the air for you guys to try and, manage everything, but I'm happy to hear that everything's going well. What I really wanted to talk to you because of your background and your expertise about this article that recently came out that, for our interest was claiming that chimps and, other primates are at very high risk of contracting the coronavirus. And so I was just hoping that you could tell me a little bit about this article and, what it might mean for chimps in the US and internationally as well.
Yeah, so research has really ramped up, obviously, because this is a novel virus. We knew nothing about it. Now, there have been other coronaviruses in the past, and actually there was an article that came out in, I think it was 2016, of a case in the Thai forest, which is on the west coast of Africa, of a chimp population there contracting coronavirus. Now, it was a different variant of the coronavirus, so it's not the same as the current novel virus, but it spread through their population and was really, really serious for the chimps that were living there. So in terms of can chimps contract just a coronavirus in general? Yes, we know that they can. There is proven record of that happening. Now, with this novel virus, what this current study was looking at was what mammals can this virus bind to the proteins. So there's this ACE2 protein that the article talked about. And we won't go into a lot of the details for the molecular stuff, but there's this very particular protein that the coronavirus can bind to. And what that means is it can then infect the cell. Right. So they were looking to see what mammal groups had this ACE2 binding protein that is vulnerable to COVID-19. And what they found was, yeah, most of the primates, especially really all but one of the old world primates, which means primates that are in Africa and Asia, they're all highly vulnerable to being attacked by COVID-19, being susceptible to COVID-19. There was one old world primate, a colobus monkey, that was just highly, instead of very highly, vulnerable. And so this article pretty definitively is able to show the risk, because you're basically looking at how it infects human cells and looking to see what other mammal groups could that happen to as well, because the cell makeup is similar, and what it's targeting is similar. And so there were some other species of mammals that were also vulnerable to it and highly susceptible. But I mean, we're really focused on, the primates here and the great apes. So the more closely related an animal is to a human, it's more likely that they are going to be at risk for these diseases. And that's exactly what this research study has shown. And what it also looked at, which is interesting, was how did it end up in the human population? So looking at what intermediate species, where it originated, what species it maybe originated in, and then what intermediate species was maybe able to help transfer it to the human population. And so there's some implications there for, a species of bat being the original host species. And then the data is still out on whether maybe it was the pangolin, a species of pangolin that was intermittent. There's been some other research articles that have come out that suggest that they potentially are a good candidate, but this article wasn't able to definitively say that. So more research is needed there to look at what intermediate species is. And the reason that's important is also for learning how to stop the spread of the virus in subsequent cases, right? Or maybe the virus mutates a little more and then could be transmitted again in a different form. So these are all important things to be able to essentially contact trace across species is what you're doing there. And, but yeah, we should be very concerned and very cautious with all of our great ape species, and then all of our old world monkey species as well. But again, the more closely related the animal is to humans, it's more likely that they could be contracting COVID-19 and have the same symptoms and risk factors. Yeah.
So this article said that chimps are in the very high risk category. So what do you think that that means for chimps in US sanctuaries, or even the chimps that you work with in Uganda?
Of course, since they are in the high risk category, that means extreme precautions have to be taken in order not to expose them, especially when you have a novel virus. No one has any pre-existing protections in terms of antibodies, right? So the response to novel viruses can be heightened. They're maybe more virulent because no one has built up any antibodies in response to it, and the disease itself hasn't had time to evolve. Over time, a lot of times, viruses and diseases will become less virulent over time because from an evolutionary perspective, the faster a virus kills a host, it needs to be more and more contagious, right? Because it has less and less time to spread. So the more virulent a virus is, the more contagious it generally is. But over time, a lot of that time that drops to allow the host to live longer with it, so you can potentially, and the contagion doesn't have to be as high, and it can infect more people, right? So there's a direct relationship there. So right now, in this novel virus, it's pretty virulent. It's pretty contagious, pretty fast. And so we need to be very, very cautious with the chimps because they are our closest living ancestors. They're our evolutionary cousins, right? And so we have to assume that they can contract this virus just as easily as we can contract it, and that they could potentially exhibit the same symptoms and have the same outcomes that we can have. So morbidity could actually be fairly high in the chimp population as well, if not even higher. We don't know, right? So this is a definite risk, and we need to be very, very careful in not exposing them to it. And I might mention too, if a chimp were to contract COVID-19, that chimp itself is not going to be able to take any protection measures to keep other chimps in their group from catching that, whether they live in captivity or in the wild. Now, the benefits of the wild, maybe there is some more just natural social distancing that happens. But I mean, they still are closely grooming one another, but it might be that, oh, maybe, you know, certain chimps don't encounter each other because they're in different parties at the time, you know, or something. But in captivity, they're stuck together. They're not going to wear a face mask. They're not going to maintain 6 feet of social distancing. So that initial point of infection is crucial that we prevent from happening, because otherwise it will then, in theory, spread like wildfire through populations. And I'll also add that chimps in general are incredibly susceptible to human respiratory illnesses.
Yeah.
We can look not just at viruses, but at bacteria, tuberculosis. If you work in captive or wild settings with primates, most people are required to get tuberculosis tests because if a population were exposed to that, it spreads so quickly, even though we can potentially treat it, that there's been in cases in captivity where massive primate populations have died due to tuberculosis. But we also know they're susceptible to other viruses, adenoviruses, rhinoviruses, influenza. So all these kind of cold and flu type viruses, we know chimps can get, and they can be deadly. Actually, at my field site, some of my colleagues have done research on this, and there was a paper published a few years back showing that in our chimp population, there was a human rhinovirus that killed several individuals in the population. So, so yeah, we have to be very careful, especially when it's a virus that the population has never been exposed to. And we know that's the case with COVID-19. Yeah.
Right. I'm really glad that you brought up the point how important it is to prevent that initial exposure, because once it gets into the population, like there's nothing that we can really do. Just like you said, they're not going to take preventative measures or precautionary measures just because they can't really, especially in a captivity situation where they're in close quarters together. There's really nothing that can be done once one chimp contracts it. It's kind of inevitable that others will as well. And I think that's why there's so many sanctuaries out there and zoos too that are taking a lot of precautionary measures to prevent that from happening. But we also know that there's others that may not be doing as much as they possibly could to help.
I think we also can't compare zoos and sanctuaries for what they're doing. Zoos are for-profit models. They operate knowing that they have income coming in from visitors coming on a daily basis to the facility. That is not the model under which sanctuaries operate or should operate. So they should have even stricter parameters for protecting their residents. So, for example, in zoos, maybe the setup does allow for some layer of protection. Maybe the primates are behind glass or the public, socially distanced. But the zoo should be taking precautions in that the workers should not be engaging with the public, right? They should be behind the scenes, caring for the primates, donned in PPE, hopefully being careful in their own personal life and reducing their exposure so they don't expose the animals they work with. But there should be I don't know if zoos are doing this, but I would recommend a clear line where they're not, maybe doing docent type duties that they might do before, or, giving public talks, or if they do, they're really far back from the general public. But in the sanctuary setting, they usually don't have maybe enough staff to do that. So if they were to hold a public event, the same staff that is caring for the animals, the primates, are going to be the same staff that is then interacting with the public. So there's no way to protect the animals from that exposure in that kind of way, even if the facility itself is set up where the public couldn't directly infect one of their residents. That's probably not how it would happen anyway. It would be a caregiver that is then infecting them because they were exposed. So by holding a big public event, you're just increasing the risk of that potentially happening.
Absolutely. And with your, experience and expertise with sanctuaries in the United States, what kind of precautions do you think that they should be taking right now to protect their chimp residents or their great ape residents?
Yeah, that's a great question. And one of the reasons it's so tricky to answer for COVID-19 is because we know now that what the CDC is saying is that 40% of cases are asymptomatic. So when you have an asymptomatic virus in that high of numbers, it's hard to identify, when you should stay home, when you should stay away, these kinds of things. And obviously, again, a lot of sanctuaries don't have a ton of staff. And so it really hurts when someone has to stay home or multiple people have to stay home. It's really hard to pick up that slack. So what I think should be happening is definitely no public events at this point, especially we have no treatment for COVID-19. It's just how your body responds, right? There's some things we can do to aid people in that, but that would probably not be very available to chimps or other primates, right? Putting them on a ventilator for countless days, not gonna happen, right? So no public events to reduce the probability of exposure. Fully donned in PPE all the time, not just when you are caring for the chimps themselves, but whenever you are out in public at work, or you can't control what the workers do outside of their work time, definitely at work, highly encouraging them to do it anytime they're out publicly as well. And then also really educating them on, and I hate to put it this way, but educating them, they don't want to be the person that's responsible for introducing it into the group.
Right.
So really hitting that concept home, this is a big deal. It's not something to just loosely, kind of have in the back of your mind. This should be altering your daily behavior. And you have signed up to caregive for these animals and provide the best possible care for them, which is the mission of, I think, every sanctuary I know, is provide exemplary care. So in doing that, you've got to make some personal sacrifices. So reducing, in your own personal life, how much you're going out. Again, they can't mandate it, but educating their workers so that they really feel a sense of integrity and responsibility to the animals that they're working with to, really alter their behavior, at least for now.
Jess, thank you so much for, taking the time out of your busy day to talk to us. I really feel like I gained a better sense of understanding. And so I really appreciate, you taking the time for us today.
Absolutely. It was a pleasure. I always am ready to talk chimp, and yeah, anytime. I'd love to engage with you more in the future.
Awesome. Thank you.